The World Health Organization says it's a mistake for any country to think the danger from COVID-19 is over. But there is a sliver of hope with the approval of another Chinese-developed vaccine. Hello, I'm Anand Naidu. This is The Heat. The World Health Organization on Tuesday approved China's Sinovac vaccine for emergency use in the fight against COVID-19. It's the second Chinese-developed vaccine that can now be included in COVAX, the global program providing vaccines to developing countries. Last month, the Chinese vaccine Sinopharm received approval. More than 1.9 billion doses of vaccines have so far been administered globally, but many countries are still struggling with enough supply. For more on the COVID-19 pandemic, let's bring in our panel. Joining us from Mexico City is Laura Carlsen. She's the director of Americas.org, an independent international relations think tank. Nelson Franco Jobim is a journalist and academic lecturer based in Rio de Janeiro. From San Francisco, Dr. Rosie Chauhan is a medical analyst and the author of the forthcoming book, Healer. And Dr. Lee Riley is a professor and chair of the Division of Infectious Disease and Vaccinology at the University of California, Berkeley. Thank you, everyone, for being with us. Dr. Lee Riley, let me start with you, and let's start with this news about China's Sinovac vaccine. The World Health Organization, as I just mentioned, now authorizing the vaccine for emergency use. That's in addition to the other Chinese vaccines, Sinopharm. 10 million doses of that were made available to COVAX. How much of a game changer will all this be for the global vaccination effort?
I think it will be a game changer. Any new vaccine that can be really added to the current armamentarium that we have will really help the situation, especially in developing countries where the vaccines are a scarce resource. And so this would really be an important milestone.
Now, Dr. Riley, of course, producing these vaccines is one thing, getting them into these countries is another. And then, of course, there's a third thing of, the infrastructure that's needed to distribute these vaccines and get them into the arms of people, especially in developing countries. I mean, how big a challenge is that?
So with this vaccine produced in China, this is based on what's called an inactivated virus. And so it's not as complicated to transport and deliver these vaccines as it is with the mRNA vaccines that you've heard about, which relies on cold chain. And so this vaccine is a little easier to transport and deliver than some of the other vaccines. So that would definitely help.
Right. Laura Carlsen, you are in Mexico, and looking at the situation in Mexico, I mean, there's a clear illustration here of the kind of hard decisions that governments have to make in dealing with the pandemic. The Mexican economy, we know, is highly dependent on tourism. The government's trying to reopen that. At the same time, it's trying to keep the numbers down on COVID. For tourists to get into Mexico, they don't need a negative test, nor are they required to go into any kind of quarantine. So what impact is that having in the country?
Well, that's right. This has been the dilemma from the very beginning. Like, how much do you put the emphasis on keeping the economy going, and not just to have economic prosperity, but also because so many people rely from day to day on that contact with the tourism industry, with selling in the streets, in order to survive. And it is really a hand-to-mouth existence that many people live. And then you have, of course, the need for health measures. In terms of the tourism, the United States put out a travel advisory on April 20th saying that people should not go to Mexico because of the rise, again, of COVID-19 within the country. The government poo-pooed that travel advisory, saying that it was a competition for spring breakers, which actually is something that has happened in the past. But what we're seeing now is, despite the fact that for the past 15 weeks, there's been a decrease in the number of cases nationwide, in those big tourism states, we're seeing an increase for the 5th consecutive week. And they're on the point of going, there's a stoplight system, but they're on the point of going to a red stoplight because of the health crisis there. So it has been a dilemma. It continues to be a dilemma, and it's one that few countries and certainly Mexico has not been able to resolve.
And Laura, what is the situation in Mexico City, where you are right now? I mean, that's one of the world's biggest cities, one of the world's most densely populated cities.
It's been very, very difficult. We have relatives in the family who work in COVID hospitals, and it's been just day after day of tragedy here for many, many long months, since about April of last year. And it's been the same kind of a trade-off. There was a reluctance to impose severe lockdown measures because so many people would have to go out anyway. And so there was kind of a middle line. Right now, the official casualties of COVID are measured at 224,000 approximately, but the excess mortality rate, admittedly related to COVID, or probably related to COVID, is at over 300,000. So we're talking about more than 500,000 deaths within the country. Now here in Mexico City, there's so much accumulated frustration on the part of people that we're seeing that with the loosening of regulations and with some of the measures, some people are going, whole hog into normal life, which could present, the ominous possibility of a third wave. Although so far, 1 in 4 people are vaccinated, and that's a good sign for a developing country. It's quite good. And there seem to be vaccinations moving forward that would give some hope that we may have seen the worst of it.
Okay, let's go to Rio de Janeiro, to Nelson Jobim. And Nelson, one of South America's biggest soccer tournaments, the Copa America, is being moved from Argentina to Brazil. And the reason for that is that we're seeing rising numbers in Argentina, but Brazil has also seen runaway numbers as well. So how are people in Brazil responding to this move?
Most people do not agree to the idea of organizing the Copa America, the America's Cup, at this moment in Brazil. But President Bolsonaro has argued that we have the Libertadores Cup, the South American Club Championship. We have the South American Cup. We have the Brazilian Championship, the Brazil Cup. So every other tournament of football is on the run. So he argued that there would be no problem. The government has decided only 10 countries will participate. Each delegation will have no more than 65 people, and all people must be vaccinated before coming into the country.
Right, Nelson, I'm wondering if Brazil is facing the same kind of dilemma that Laura was talking about a moment ago, and that is trying to keep the economy open, trying to get money into the country, and at the same time keeping numbers down. It's a very hard decision for the government. I mean, if we look at this same tournament last year was held in Brazil, it brought in $118 million. I mean, to what extent are these government decisions being driven by the fact that they need to keep the economy keep it running at the same time?
Well, from the beginning, President Bolsonaro said that the economy should not stop because of the pandemic, and he argues that we should have protected the groups of risk, the elderly people, but not stop the economy, because he argued that the damage will be much worse, which is not exactly what's happening, but. Well, today we had the GDP figures for the first quarter, and it was 1.2 above the expectations. The expectation was 0.7, so the economy is doing reasonably well despite all the problems. Today I just checked in the city of São Paulo, the largest city of the country and the economic powerhouse of Brazil, 40% of the people are taking measures of social distancing. Mm-hmm. Most of the population is not.
Dr. Rosie Chauhan, let's look at the situation in the United States. There are now more than 50 million Americans who have been fully vaccinated. I mean, as some confidence has been returning to the country. We saw that over this long weekend, the Memorial Day weekend, people traveling, millions of people traveling across the country. Beaches were packed. Are there any concerns that the country could be reopening a little bit too early, that this might be a risk?
Well, yes, it is a risk. But the good news is that we're finding out more and more about the virus and the coverage that the vaccinations currently available, the Pfizer, Moderna, and the DNA vaccines are providing, and that is most of the variants are being covered by that vaccination, but not all of them. There are others aside from the UK, South African, and the Indian mutation as well. So. I mean, the CDC has pretty much opened things up and left it as kind of up to the private citizen to really wear a mask, not wear a mask. The only good thing is that restaurants are still required to have some social distancing, and that even vaccinated employees are still wearing masks. We can expect rises and spikes wherever we open up fully. So we have to kind of accept that there's going to be a new normal, and that is that there are going to be some cautionary guidelines and some new way of doing things, whether it's school, education, vacations. We have to, if you want to be safe and stay safe. The other thing we have to bear in mind is that aside from variants and mutations that aren't covered by the current vaccinations, no doubt new vaccinations will continue being developed. We don't really know the source of this virus really, and where there's a source, there might be other viruses too. So I think we need to kind of start thinking about protecting countries, and if we don't want our economies to crash, we really do have to accept that there is a new level of normal. It may not be the lockdown that we had previously, but there is going to be a hybrid situation if you want to be safe.
And Dr. Chauhan, when you speak about cautionary guidelines remaining in place, what kind of guidelines are we talking about?
Well, I can only speak from a personal standpoint because, CDC officially has said that, vaccinated people don't have to wear masks and it's up to different people. But like, for instance, returning to work is still not clear because essentially CDC said it's up to the locality, the company, the state to mandate their own guidelines. These are just suggestions. So right now, as the workforce contemplates and businesses contemplate having their employees return, what are they going to do? It's going to cost a lot of money to keep barriers up, to have people go around cleaning things, to update the ventilation systems, and the other thing is that we have now accepted that people can work remotely, study remotely, and why would that change moving forward? So that's why I say there's a new normal. Necessity is the mother of invention, and we've invented new ways of doing things.
Dr. Lee Riley, on Sunday, India, which has become the epicenter of the pandemic right now, it reported its lowest daily rise in infections in 46 days. And there were reports last week that the country's second wave could have peaked. Do you believe that to be the case?
It's possible, but one of the things that's happening in India is that many of these infections, of course, were occurring in large cities. And so when that was happening, many of the people who lived in the cities went back to their homes in rural regions of the country. And in the rural regions of the country, testing is really difficult to do. And so I don't think we're getting the full picture of what's going on in the rural regions of India. And so we have to take the current data with some skepticism, but the trend seems to be consistent. That it appears to be going down, and it's been happening, I guess, in the last 2 weeks or so. So we have to see what's really going on, but we have to be somewhat skeptical of the data that's coming out.
Right, there have been experts from India who've said that there's been a serious undercount in the number of cases in the country. Dr. Riley, one other thing, if we look at the capital of India, New Delhi, it announced that it's lifting restrictions for workers in the construction industry, in manufacturing as well. These workers have been home for the last 6 weeks. Now they will be coming back to work. Is this a good idea?
Yeah, again, for the same reason, I guess, that we just discussed, that whenever you start relaxing these restrictions, we see the resurgence of the transmissions, and I think they really have to monitor what happens with this relaxation. There's some risk, especially with the so-called variants that are emerging in large cities in India. I think they have to still be careful, but we have to see what happens.
Right, and as you pointed out, a lot of these workers will be returning from these rural parts of India that you talked about.
Exactly.
Nelson, there were massive protests in Brazil this past weekend against President Jair Bolsonaro. What is the vaccine rollout looking like in the country right now?
Brazil is under threat of a third wave because the vaccination is slow, and we have this new variants. We had 6 cases of the Indian variants diagnosed. Which have been reported in the country, and so far 10.5% of Brazilians have been fully vaccinated. We should do it at least 1 million and 1,005,000 people a day to reach the goal of vaccinating all the adult population by the end of the year, but at this pace probably will not get there.
Laura, the Mexican President Andrés Manuel López Obrador, he says that Mexicans aged 40 to 49 will get the vaccine. Well, he initially said they would get the vaccine in July, but that's been brought right up to this week. It's been forwarded to this week. Are there more vaccines available in all parts of Mexico now?
Mexico is in a relatively good position compared to certainly most developing countries, and that's for a variety of reasons. One is that they began very early and they had the resources to pre-order vaccines. So they got their orders in, and although they came in slower than they anticipated, they did begin to get vaccines. And then also Mexico is licensed and actually is not producing, but packaging the CanSino, the AstraZeneca, and now will start packaging the Sputnik V vaccines. It hasn't had political criteria. It takes vaccines that are approved internationally, and that means that they have gotten access to those vaccines as well. They're also anticipating that they could actually have a Mexican vaccine by the end of this year or by the beginning of next year. But I think, it's important to mention one of the points that came up, which is that this is a specific case in Mexico where we seem to be better off than many countries. But as long as other countries are unable to control the pandemic, no country is safe from having it come back in a globalized world. And we still have a situation where, for example, in Africa, only 2% of countries have gotten 1 dose or only 2% of the population has received a single dose. And so if we don't start looking at especially the necessity of a TRIPS waiver, that is to say, the suspension of patents that now the United States government has also endorsed in order to increase production of vaccines without the odious requirements of patenting, so that third world countries can begin to do their own production, we won't be able to get a handle on this at a global level.
Just on that point, Laura, on developing countries being able to manufacture their own vaccines, I mean, how does this Mexican system work when you say they're packaging? Are these vaccines sent to Mexico in bulk, and then is it sort of repackaged into doses there?
Yeah, basically it's packaged here. So what that means is that they're not getting the formulas. They're not able to produce the vaccine from the bottom up, but they are doing the packaging, which means that they kind of get a first dibs on the domestic distribution of what they package here in the country, and that's put them in a situation where they have more access than many other countries.
And Laura, does the Mexican government have a good strategy to distribute these vaccines throughout the country? I mean, do they have a plan, not just for now, but a long-term plan?
Yeah, it seems to be going fairly well. They began with health workers, and then they went to teachers with the goal of reopening the schools, and then they went to the different age groups. They have had some trouble targeting. I mean, there were areas where people don't even have fresh water, that should have been targeted first because the populations are at greater risk. They haven't taken into account all the comorbidities that contribute to the death rate. It hasn't certainly been a perfect rollout of a vaccine situation, but they seem to be getting around, and even to some of those more remote rural communities that are so difficult to get vaccines to. We do not have the problem here in Mexico that they have in the United States, there's a sizable population that is anti-vax. Yeah. That's one of the advantages, although we have had moments in which there were people who were reluctant to really believe in the seriousness. And a lot of that came from mixed messaging from the president himself.
Dr. Rosie Chauhan, here in the United States, as I said earlier on, 50 million Americans have now been fully vaccinated. President Biden is hoping that that number will be 70 million by July 1st. That's a month away. Do you believe the country is on track to meet that goal?
I think it may be. There was a bit of a slump last month, a bit of a downward trajectory in terms of the number of people taking up the vaccination after the initial spike upwards, and the lottery systems in California. There's different techniques that people are trying to, the local governments are trying to encourage the uptake of vaccinations. But whether it's this month, next month or the next 2 months, there certainly is momentum in trying to obtain herd immunity by the U.S. government, by President Biden's administration, to try and get herd immunity as soon as possible.
Dr. Chauhan, what is the point we're looking at when there would be some kind of herd immunity in the United States?
Generally speaking, it has to be above 60%, but when you apply herd immunity to any group, essentially it's for that particular virus. And so we're talking about herd immunity for the initial COVID virus. Now there are other variants and mutations, and luckily, like I said, they are at least 50% of them so far are covered by the current vaccinations. But that doesn't mean that a new virus would be covered under herd immunity. So it only pertains to the initial virus or the initial strain, or all variants that have been proven to be covered by the current vaccination. So basically what I'm trying to say, if there's a variant or a mutation that is not covered by the current variation, you're resetting the clock for herd immunity.
Yeah, that's
so there has to be ongoing development of vaccinations, and that's why I say that we have to look towards a new normal, because this is now going to be an ever progressive situation. COVID is never going to be going away completely. It's not like the flu. It's not like Ebola. It's not going to burn itself out like this. So therefore, we do have to look at strategies to protect ourselves moving forward.
And Dr. Riley, to Dr. Chauhan's point, as I said right at the beginning of the program, the Director General of the World Health Organization has cautioned that the pandemic around the globe is far from over. This is what he had to say. Let's listen.
The reality is we still have a lot of work to do to end this pandemic. We're very encouraged that cases and deaths are continuing to decline globally. But it would be a monumental error for any country to think the danger has passed.
Now, Dr. Riley, we know numbers are very high in places like India, in Brazil, in parts of Africa as well. But where do you see the most vulnerable hotspots right now?
Well, I think if you look at the trend in different regions of the world, you can actually probably look at the vaccination rates and then predict what countries will fare the worst and where the resurgence might occur. And so I think India and Brazil are still potential areas where another resurgence may occur. But there are many of the African countries, of course, where the vaccination rates are really low. And especially in large cities of those regions, I think we have to continue to worry. And I'm also a little concerned about China itself. China's been really spared of the huge resurgence, but the vaccination rate there is not as high as it could be. And so, and China is a hugely densely populated country, and so that's also a potential future hotspot.
And as we just heard a moment ago, Dr. Riley, I mean, we cannot be safe until most of the world is safe, because people continue to travel unless there's going to be separate lockdowns all over the world. But that's very difficult to implement, very difficult to enforce. So there has to be some very broad vaccination program that will see the entire world being vaccinated before we feel safe. Isn't that so?
Exactly. So, so Dr. Chauhan mentioned herd immunity. And, if you really think about different types of infectious diseases, there are not that many infectious diseases for which a vaccine exists, and we've been able to achieve herd immunity. For instance, diseases like polio, it took many, many decades for herd immunity to be achieved, and then to a point where we don't see very many polio cases anymore. Smallpox took more than 200 years after the vaccine became available for it to be eradicated from this planet, and it took just many decades for herd immunity to be achieved. So people talking about herd immunity with COVID-19 in less than 2 years after the pandemic began, that just is not going to happen. Herd immunity for a particular country is just not something that makes sense. Herd immunity has to occur for the whole planet, and that's just going to take many decades if this virus were to continue to exist on this planet.
And Laura, we're seeing another trend in Mexico, actually, and that is thousands of affluent Mexicans who are traveling to the United States to get vaccinated. Most of them have been traveling to Texas, which is, of course, very close to Mexico, but New York is now promoting itself as a vaccination destination. What can you tell us about this?
Yes, that's true. I mean, it's somewhat the uncertainty. For example, many people received the first dose here in Mexico, but because the supply is a little less certain than it is in the United States. In the United States, you get your first dose, and they give you the date for your second dose. And you know exactly when that's going to happen. But here, many people didn't know when the first dose was going to be or the second, and so the people who could afford it could go to the United States. And that's the proximity to the United States has been another aspect that has put Mexico in a somewhat privileged position. Also, there was the case when the Biden administration said that they were not going to send any doses to Mexico, and then they finally did send 2.5 million of AstraZeneca to Mexico, reportedly in exchange for an agreement to crack down on immigrants coming up through Central America. But there's been a number of advantages of being close, and it's certainly true that those who are wealthy enough to do so have gone to the United States for that.
Dr. Chauhan, very quickly, I've just got less than a minute left, but the CDC has released guidelines for unvaccinated children at summer camps. Children aged 12 and over are encouraged to get vaccinated. But what is the situation concerning children in the U.S.?
Well, currently, now that the FDA has given approval to Pfizer for their vaccination, basically children from age 12 and up can be vaccinated, whereas before it was 16 and up. But now, essentially, high school children should be vaccinated. But then we have the younger age group,
right.
and companies are currently working on getting vaccination approved for a younger age group. But they are at risk of spreading the virus, unless, of course, their parents are vaccinated and those around them, and their teachers are vaccinated, of course. But they are also going to be susceptible to multi-system inflammatory syndrome, which is a serious condition. It's rare, but it does happen. And so they don't get off scot-free, is the point.
Okay.
And, yeah, so those are things to consider for the future. I would advocate that we need to start having to look at a global consortium on how to deal with this SARS virus, as well as other impending viruses that might cause future pandemics.
We have to go. Thanks to all of you for being with us. That was a great discussion. Thank you. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.